Okay, that's gone. So here I didn't make any incision outside. Huh? I just put some pressure from. Open your mouth. Some more. Is it paining when I do this? Okay. Right. It's healing well, but it'll still take some time. Huh? It'll still shrink more. You can have a look at this. You can hold it. See, this side you will have a small scar that won't be visible, but that will go away. But we need to take the sutures off. Here, like I said, little bit excess skin might be there, but the rest of the hemangioma, all gone. We've removed everything. Did you see the specimen that we removed?
Yeah, yes.
Oh yeah, that was pretty huge, huh? It was huge. But by God's grace, it came out like easier than I thought. So I think I asked you, we said, yeah, I want to go on the 6th and all that. You're good to go. Because you've had a very smooth recovery, no bleeding, like everything was totally...
Can she fly with me?
Sure. I think you can go wherever you want to go.
The tent I already booked.
She can go.
No issue.
I think you can go. Unless you have some bleeding episodes after this. തിരിച്ചൊന്നും വരണ്ട മതിയായി ഫിനിഷ് ഈ സ്റ്റിച്ചസ് നമുക്ക് നാട്ടിലെടുക്കാം ഇന്നിവിടെ എടുക്കണ്ട ബിക്കോസ് ഇറ്റ്സ് ഓൺലി 4 days. After, before you go to Dubai, just remove it. It's easy. Anybody will remove. Inside the mouth, don't touch. And important instruction, right side la vechittu don't eat any food for minimum 1.5 months. Because before it heals, if you bite, A, it can bleed, and B, the sutures can come off, and the sutures they're slightly, how do I say, dissolvable, but I've used a little long dissolvable ones. It might be there for 2 months also. Don't do anything with it inside the mouth. The longer the sutures stay, the better your result will be, because more fibrosis will happen. When more fibrosis is there, it shrinks better. That's the logic. And inside also some stitches are there, that of course you don't have to touch. And avoid sleeping on the right side. Sleep straight, sleep left. Eat on the left side. Eat what you want on the left side.
And other things,
Sure.
She can eat. On the right side.
Not on the right side. Carefully. Cheek bite varadhu.
Okay.
When you're eating, you'll be very careful. Don't have anything very hot.
Yeah.
Because the right side might be numb. That's about it. After 1.5 months, 2 months, you can do everything normal you can do. Swelling won't be there, nothing will be there. Varanda. That's the biggest thank you. In the varanda. Yeah, a lot of the patients are like that because we're really in one corner of India, It's difficult for you to come.
We have come from Dubai, so that's also another. I cannot take a lot of leaves
Yeah, that is true. Anyway, it's
in case you will be visiting Muscat.
I will be visiting Muscat.
Because I have a Muscat visa also.
Then you can come there if you need.
Give me your Muscat contact number in case of anything.
No, same number you can contact me.
Yeah.
I'll give you my number. You can contact me.
Okay.
My Omani number sometimes is not active.
Okay.
I may not come this month, but next month I might
In case
come.
of any emergency.
Yeah, easily
or
you can
anything,
come there.
Okay.
You can easily come if anything is there, but there will be no emergency.
Okay.
I don't foresee for 2 reasons. Because see, we removed everything in toto first. So there's no chance that some other guy is inside to cause bleeding. Secondly, so far also you didn't have anything. So generally, if it's like that, then it should not be anything. So I don't expect any issue. That's why I'm saying you can safely go. Just follow these instructions. Take the antibiotics. For now, we stop the IV antibiotics, give you tablets. Take that. 1 or 2 tablets for swelling. Madi. And your biopsy report, Vanna, I think it's not. One knows it. I have not seen.
Give to doctor.
Few people have not told me the biopsy report. Yeah, cavernous hemangioma, cavernous angiomas. Right, so you can see here. Let them. So this was the hemangioma that we sent from her. It was in the cheek. You can see here, it was a pretty large one. 5 centimeters by 3 centimeters by 2 centimeters. That's pretty big one. And another one, 1 centimeter, 1 centimeter, 0.5 centimeter. The second one was from this area, which was close to the forehead. And so both of them show dilated blood spaces with endothelial cells packed, which is very suggestive of cavernous angiomas. All right, so that's a good news. So this is not going to recur and it should be settled for life. And also they say it could be an AV malformation. And here are the leash. They've written all the details about the hyperintense honeycomb pattern, everything. All right. Good. So that's it from us, I think. You're welcome.
Yeah.
See, even though I've done, I don't know how many hundreds of hemangiomas, some are really nasty. Some are like this, that go very smooth. It's very difficult to predict because hemangiomas and cavernous angiomas, whatever we do, whatever vessels are there, there are a lot of things. How do I say? It's always, every case is a different challenge, unpredictable. And because of that unpredictability only, most doctors refuse to do anything apart from injections because there's a risk involved. There is a risk, even though you're very good or anything, there is a small risk with this. Like, we always keep blood ready. In your case, we didn't even lose any blood. That we had to even think of it on that lines. But we did a patient after you, right? That lady who had she had more bleeding 2 days before we did. It was a neurofibroma, hemangioma on the eye here. Not as big as yours, but she had 4-5 times more bleeding. Yeah. It can happen. She's doing well now, but I'm saying the initial, it varies from one lesion to another. Very difficult to correctly predict. So it was good that your thing has gone smooth. So you take accordingly care. Make sure everything heals, and this is just the past then. We put your video on Instagram, and I had doctors and surgeons, not one, many asked me if embolization was done. How do you remove like that? Because it was like a big one with full big blood vessels sticking out,
It will be in the YouTube, right? We can also view it.
YouTube is not there, I think. I think I put that surgical thing on Instagram only. I've put. We have a lot of doctors, surgeons, and students following. It's not the before after, but like the bloody things.
I saw from this YouTube, I saw videos.
Some of your videos.
Yeah,
that's why-
YouTube will put, but
Yeah.
so much of surgical details we avoid because YouTube doesn't like blood content.
Correct.
Instagram is good because the people who want to learn, surgeons, following juniors, they all will get to see. So what we're doing and how we're doing it. It's like that, patients go and then suddenly something happens and they're like trying desperately, all things, and I don't respond. Then you feel bad.
I deal with construction.
Okay. Nice.
Yeah.
You're having construction in Dubai? Okay.
I'm MD for 3 companies.
Oh, wow.
I own branch in Muscat. That's why I said.
What
We are into full-fledged construction.
What all constructions do you do?
Building, we are mainly into MEP service. Electrical.
Okay, cool.
Also, we have civil contracting along with that.
Okay.
And we are trading, we are advertising.
Oh,
Yeah.
very nice then, because my dad's also a civil engineer.
Okay.
He's in Bangalore with our metro.
Okay.
He's a director for the metro. So he's with the government now. Earlier, he was also in the private sector. So if you're in constructions, it's good because in Muscat also, actually I'm now in Muscat for about 6 years. I like the place. And maybe we will do something there. Is what I'm thinking.
Also, Dubai is the vast,
Dubai is too big for me, it's too big.
No, be in touch. We can help you out.
Dubai, this Burjeel Hospital, they are after my life. To join there, I don't want to go because I don't have time. And I already like Star Care. Upon the management are Malayalis and some people from London. I'm very comfortable there because I have my instruments. Everything is set up in the last 6 years. If only Pudu site I have to do in another place, it's hard for me. And
If you have any plan, let me know. I have a lot of connection with the doctors as well.
maybe I will have some plan in the construction thing.
Why not? Most welcome.
In
We
Muscat.
are approved by all the government authorities, municipality,
Okay.
all authority we have.
So in Muscat, if something like that comes up,
Definitely.
then I will.
Dubai also, if you want to have some property or you want this place.
Dubai, no. I've been there a few times, but every time I think it's a bit. And also you need to be there for quite some time to get used to the place, right?
Yeah, yeah.
Since I'm going here, Muscat, I've just got used there. Smaller city,
Yeah.
much more homely.
The size-wise, Muscat is much bigger than UAE.
Uh,
It's one corner to another. It's a huge, big place.
but small in the sense.
Development, of course, Dubai is the best in
Yeah.
development, Middle East.
Correct. There's no doubt about that. This is. And what is just 5-6 hours drive, right? If you
From where?
if you drive also
No, hardly 3.5 hours.
3.5
From
hours,
Dubai,
yeah.
Muscat.
by road.
No, mostly I take flight only.
Yeah, it's even 30 minutes. Many times even because I'm a frequent flyer with Emirates,
Okay.
so they go via Dubai only.
Correct.
I don't have a frequent flyer thing with Oman Air.
Okay.
I used to have Jet Airways and Emirates. So,
You will get more facilities there.
and I used to use it for going to the US,
Yeah,
other long
actually,
distance
I used my
also.
full miles to book my ticket.
Yeah, it's very
I have
nice.
to book for- So there is
Emirates is
nothing
very
wrong to
nice.
travel with me.
I think she can
10
travel.
early morning, I have a flight 10 minutes. I mean,
I think you should be able to. You're fine to leave. On 9th, you can take the switches off. 2 more days are there, right?
Okay.
But, you live in Trivandrum otherwise?
Yeah.
Very easy. And where do you live in Trivandrum?
Nalanchira.
Lanchara.
Keshavadasupuram.
Ah.
So close.
Okay, near Pattam and Keshadaspur.
Yeah, yes.
Okay.
2 kilometers away from Keshavadasupuram. Hardly 2.
Then you can come also here if you want. We can do a checkup on the 9th.
I got a lot of things to do there.
You can send her on a taxi or something. You can wait and go back. If possible. If it's Trivandrum, it's just 2.5 hours drive. Or get it done there. No, I don't think there'll be any
To
problem.
remove this one. Otherwise,
Otherwise,
other
nothing will be
checkup I
needed.
don't.
No.
Let's do get it done there.
You can get it done nearby.